welcome to the deep dive. Today we're diving into procalcitonin in the ED.
That's right. We're taking a look at the American Journal of Emergency Medicine, volume 89. They came out with new guidelines. It's a good resource for, providers.
Okay, so for those who may not know, what is procalcitonin?
So procalcitonin is something your body makes, a biomarker, when you have a bacterial infection.
Okay.
And the interesting thing about procalcitonin is that it can help us differentiate between bacterial infections and viral infections, which, as you know, in the ED, that can be really tricky.
Mm-hmm. Yeah. And that's important for deciding, do we need antibiotics or not, right?
Absolutely.
So how does this new guideline recommend using it?
Well, it covers a lot of ground. It looks at its role in sepsis, looks at its role in guiding antibiotic use in lots of different conditions. And it even talks about how, certain diseases or patient populations can actually impact its accuracy.
Okay, so let's start with that first one, antibiotic stewardship. How can it help us use antibiotics more wisely?
Yeah, so it talks about procalcitonin's potential to cut down on the number of antibiotic prescriptions that we write. So in a lot of different situations, like, for example, lower respiratory tract infections, it says that if the procalcitonin is above 0.25 nanograms per milliliter,
right,
antibiotics are probably warranted. But if it's below that, antibiotics are probably not needed.
So it could help us actually rule a bacterial infection.
Exactly.
So then we don't give antibiotics that they don't need.
That's right. And that's huge for antibiotic stewardship. Because, cutting down on unnecessary antibiotics is really important to fight antibiotic resistance, which is a huge problem.
Yeah. But this guideline, it says, don't just use it by itself for every condition, right?
Exactly.
Okay. What about COPD? What does it say about acute exacerbations of COPD?
So the evidence for using procalcitonin for COPD is it's not as strong. There are some studies that show it can decrease antibiotic use, but then there are other studies that show it doesn't really change, outcomes or prescribing habits. So more research is needed for that.
Okay. So not a slam dunk for COPD. We have to be a little more careful.
Right.
What about fever?
Right.
Like just fever or suspected heart failure?
Yeah, so the guideline specifically says that we should not be using procalcitonin by itself to make decisions about antibiotics in those situations.
Okay.
So if a patient has a fever or suspected heart failure, we shouldn't be saying, oh, well, the procalcitonin is this, so I'm going to do this.
So other things to think about besides just the number, right?
Right.
Okay, what about pyelonephritis?
So pyelonephritis is a good example where procalcitonin can be helpful. The guideline says that if you combine procalcitonin with pyuria, which is pus in the urine, you can actually decrease the amount of antibiotics that we're using in patients who have pyelonephritis and a fever. And that strategy has been shown to, reduce antibiotic use without messing up patient outcomes.
Okay, so it helps confirm the diagnosis and it can help us treat or decide on how to treat?
Exactly.
Okay, acute pancreatitis, what about that?
So for acute pancreatitis, the guideline gives us a specific number.
Okay.
It says if the procalcitonin is above 1 nanogram per milliliter, then antibiotics are probably needed. But if it's below that, then we probably don't need to use antibiotics.
Okay, so another specific cutoff.
Yes.
Okay, so once again, helping us avoid those unnecessary antibiotics.
Yes. And, this is one of the biggest reasons that we, try to incorporate procalcitonin into what we do, because it can help us not harm our patients by giving them antibiotics they don't need.
Okay. Now, let's talk about sepsis, because that's a big one, right?
Yeah.
It's life-threatening. We need to know quickly, can it help us diagnose sepsis?
The guideline is really clear about this. They say, do not use procalcitonin by itself to diagnose sepsis.
Okay.
You have to combine it with other clinical stuff.
Okay, so not a replacement for, our assessment.
Right. It's just one more thing to help us figure out what's going on.
And it specifically mentions SIRS criteria and qSOFA. Can you explain those?
Sure. So SIRS criteria stands for Systemic Inflammatory Response Syndrome. It's a set of things that we look at, the patient's temperature, their heart rate, their respiratory rate, their white count, and it helps us know if they have inflammation in their body.
Okay.
And qSOFA stands for Quick Sequential Sepsis-Related Organ Failure Assessment. And that one looks at organ function. It's just a quick way to see, okay, is this patient at risk for sepsis?
So these help us identify patients who might have sepsis, but they're not perfect.
Right. That's where the procalcitonin comes in.
Okay.
You add the procalcitonin on top of that, and it helps us get a better idea of who really has sepsis.
Okay, another piece of the puzzle.
Yep. And the guideline even says that when you use procalcitonin with qSOFA, it increases the sensitivity and specificity of diagnosing sepsis.
Okay, so now, are there certain patients where procalcitonin may not be as accurate?
Yes. The guideline talks about a few specific situations where we have to be careful. So, for example, it says that if someone's had gastrointestinal surgery, the procalcitonin can be falsely high.
Okay, so it might look like they have an infection even if they don't?
Right. So just because the number is high doesn't mean they need antibiotics.
So we got to look at the whole picture.
Exactly.
Okay. What about cardiac surgery or burn patients?
Yeah, so interestingly, the guideline says that procalcitonin seems to be pretty reliable after cardiac surgery or in patients with burns.
Okay.
There doesn't seem to be a big increase in false positives or false negatives in those patients.
Okay. What about febrile neutropenia or lupus?
Yeah, so both of those conditions can cause procalcitonin to be falsely low. So if someone has fibronneutropenia or lupus and their procalcitonin is low, it doesn't necessarily mean they don't have an infection.
So we can't rule out an infection just because it's low.
Exactly.
Okay. Are there any specific infections where procalcitonin, doesn't work as well?
Yeah. So the guideline talks about a few. For example, it says that for osteoarticular infections, procalcitonin is good at confirming the infection if it's high, but it's not so good at ruling it OUT if it's low.
Okay. What about endocarditis?
So for endocarditis, the guideline says that there are a lot of false negatives. So if the procalcitonin is low, it doesn't mean the patient doesn't have endocarditis.
Okay, so it's not helpful for ruling it out.
Right.
Okay.
So the guideline gives us some recommendations for specific populations. So for example, in patients on hemodialysis, it recommends using procalcitonin to see if they have a bacterial infection. And it even gives us specific numbers. A level above 1.5 nanograms per milliliter is good for confirming an infection, and 0.85 nanograms per milliliter is helpful for saying they probably don't have an infection.
Okay, so those are some useful numbers to know.
Yeah.
Okay. What about peritoneal dialysis?
So for peritoneal dialysis, it says we can use it to confirm bacterial peritonitis, but we can't rely on it to rule it out.
Okay, so good for one, but not the other.
Right.
Okay. What about liver cirrhosis? Any recommendations there?
Yeah. The guideline recommends using procalcitonin in patients with liver cirrhosis to figure out if they have a bacterial infection. It can be really helpful for diagnosing something called spontaneous bacterial peritonitis, which is a pretty serious complication of liver cirrhosis.
Okay. And it also mentions patients who have had transplants, right?
It does. So for solid organ transplants, it recommends using procalcitonin to check for infections. But for stem cell transplants, it says the evidence isn't strong enough to support using it.
Interesting. So it depends on the type of transplant.
Yeah.
Okay. Now, I'm really interested in this part. It talks about using procalcitonin together with molecular testing for respiratory viruses. Can you explain that?
Yeah, this is really cool. So imagine a patient comes in with cough, fever, shortness of breath, all the signs of a respiratory infection. In the past, we might have just started them on antibiotics right away.
Just in case.
Right. But now we have these tests that can quickly tell us if they have a virus.
Okay.
And if the test is positive for a virus, we might be able to avoid antibiotics. And that's where procalcitonin comes in. If the procalcitonin is also low, it makes us even more confident that it's a virus and we can hold off on the antibiotics.
So it's like two pieces of evidence pointing in the same direction.
Exactly. And, this could really help us reduce the amount of antibiotics we're using.
And I even read that some EMRs could start alerting us to this.
Yeah, that's the idea. So you can imagine a doctor going to order antibiotics, but then the computer pops up and says, hey, wait a minute, the procalcitonin is low and the respiratory viral panel is positive. Are you sure you want to do this?
So it's like having a little, little helper.
Right. A little reminder.
A little reminder to make sure we're thinking about it.
Exactly.
Okay. Well, I think we've covered a lot of ground on how to use procalcitonin in the ED.
Yeah, we have.
And just to emphasize, it's a tool.
Right.
It's not a replacement for our judgment.
It's just one more piece of information.
Exactly. Well, I think we've really dived deep into procalcitonin.
We have. It's been great.
We've talked about what it is, how it works, when to use it, when to be careful, what it might mean for the future.
It's a fascinating topic.
And I hope our listeners have learned a lot.
I hope so, too.
Thanks for joining us on The Deep Dive.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.